Hi everyone, I'm Dr. Faisel Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Today, we're talking to Dr. Eric Grasser about meaningful medicine. Let's dive right in.
Well, it's good to be back. Today we've got a great episode about meaningful medicine, and our guest is Dr. Eric Grasser. Dr. Grasser, welcome.
Thank you. Good to be here.
I'm intrigued about the type of medicine you practice and this phrase that you've coined called meaningful medicine. In our world, in the full risk model, we don't believe that we are effective unless we're improving health. So if you can please kind of expound a little bit around this concept of meaningful medicine.
Sure. I came up with the term because, I was trying to think about what would explain meeting the patient where they're at and providing care that they want, and taking maybe some preconceived notions of what medicine I should deliver to the patient out of the equation and putting it back into the patient's hands, which would be patient-centered care. And I realized that after I had, studied other medical systems and learned additional skill sets and wanted to bring that to my patients, that really it mattered less what I knew and mattered more what they wanted. Because, obviously people have become somewhat disenfranchised with the medical system in this country, and they don't always feel like it's patient-centered and serving them. And I realized that just by listening to people and hearing their stories and understanding what they were looking for in the relationship or out of the medical system, that I could probably deliver that to them as long as I was open-minded and didn't bring in my assumptions about what was best for them. So in that way, it's meaningful to the patient, but the great side effect is that it's meaningful to me as well, because I get to actually provide patient-centered care and please people and allow them to, kind of tap into a variety of different modalities and a variety of different styles.
Why do you think so many Americans feel disenfranchised with our healthcare delivery system?
Well, I think that at the end of the day, patients want to know they're being cared for. And and that comes through trusting their physician, trusting the medicine that their physician is practicing, being heard, being able to navigate the maybe technical aspects of the healthcare system. And I think that's fallen a little bit off, or quite a lot off in our medical system. I mean, we're overburdened. There's limited availability of both primary care and many specialties. There are long wait times. There are inefficiencies in our organization, in our charting, in our EHRs, in our flow. And so people get disenfranchised, and a lot of folks, especially older folks, they remember a time when it wasn't like that, and they want it to be like it used to be. I mean, most people want to have their primary care doctor, their family doctor, know them for a longitudinal period of time. They would love it if you would go to their house. They would love it if you would be available to them as much as possible, and that you just know who they are and that you've been through things with them, and maybe you know their family, and maybe you know multiple generations of their family, and that you know their community as well, that's part of their health. And so I think a lot of it is just, I hear this from patients all the time. Well, you remind me of the family doctor we had when I was a kid. That's what people want. I mean, we're the gatekeepers, right? And they want to be able to trust us. And you just can't do that in 10-minute increments with people a few times a year. It's just impossible.
Definitely cannot. There's definitely that desire of getting back to the basic core relationships that we used to have for each other. It was really like that was one of the things in the American culture that was so inspiring for many people to come move to America is just like the tight sense of community that used to exist. My father is a Chen Med patient, and he's a retired inventor, and he worked with technology in his heyday, and he always thought of technology as becoming like an extension of our humanity. He never thought that, we were such a tight knit community. I think about all the neighborhood get-togethers and the families coming together to meet with the picnics and things like that. That he always thought that technology would allow us to connect better with each other as a society. He never thought that it would really come in the way of the relationships that that people have with each other. So I think what you're saying is true for the seniors in particular who were used to that. And they were probably expecting, it's probably safe to assume that many people were expecting that with the technology, it would allow for us to connect better with each other,
Yeah.
especially with regards to our health.
Yeah. No, absolutely. And I mean, of course there are ways to leverage the technology to that advantage. But it's quite cumbersome for a lot of people, especially folks that just didn't grow up with the technology from the beginning. I'm sort of the generation that's kind of right in between. I got to see what life was like before the personal computer and the smartphone and the digital age. But I've also, learned it early enough that I'm able to harness the benefits of it. You mentioned, the pandemic and how we're meeting in this format because of it. And I've kind of pivoted the same way. I used to host meetings for my patients in person where we would all get together at a coffee shop or a restaurant and share some food and I would talk and then we'd have an interactive conversation. And as soon as the pandemic hit, I just pivoted it to what I call town hall style meetings that we do once a month with my patients, many of which, have been centered around COVID and how to stay safe with regard to that. But also, it's me doing a talk on osteoporosis or cardiovascular disease with slides and screen sharing, and then a chat and putting people on the microphone and letting them talk. And those have gotten to be really popular. So, the learning curve was there. People had to learn how to log into a meeting, but once they figured that out, that's been, very popular. In fact, I was trying to do that before the pandemic. I was doing what I call journal club, and it wasn't getting much attendance, but the town hall meetings, and I kind of lured them in with COVID information at the beginning, but now people are showing up for those no matter what the topic is.
Yeah, it's incredible what's become socially acceptable now as opposed to what was before the pandemic.
Yeah, no, absolutely.
I didn't get to ask you, usually when we meet, we bring on a doctor, we love to hear the story. We love to hear your
Yeah.
story about what you studied
Yeah.
and how you came to practicing your unique style of healthcare delivery.
Yeah. Well, I mean, I obviously entered into medicine in a traditional path. I mean, obviously, we all have to go to medical school and do a residency. And in medical school, I had taken a year as a research scholar and went and worked in Guatemala in an underserved community of indigenous Guatemalans. And I think that opened my eyes to just how you can practice medicine with minimal resources. And it kind of took me back to a lot of old medicine or slow medicine, if you will, because a lot of times I was working in a facility where there wasn't much we could do for people because we had minimal access to medication or procedures or testing. And so I got into, a kind of, I opened my eyes to the world and to a different style and the emphasis on the relationship. And then I also became fluent in Spanish. And so I decided I really wanted to do my residency somewhere where I could keep practicing Spanish. So I went from, med school at Dartmouth in New Hampshire out here to New Mexico for my residency so that I could speak a bunch of Spanish and be in the mountains. I practice in Santa Fe, New Mexico, which is also kind of a hotbed of integrative practices and holistic practices and Eastern practices. And so I kind of also got into that and serendipitously discovered that there was a school of Ayurveda in New Mexico. So after practicing in a community health center setting for about 5 years, I quit my job and went and studied Ayurveda, which is traditional East Indian medicine. But more than that, it's the knowledge or science of life. So it's an entirely codified system of how to interact with the world, or like I like to say, how to get back in touch with the laws of nature.